Welcome again to another segment of ACRP TV. Our spotlight today is on one of our upcoming conference sessions. We've got a great panel with us here to talk about how to build community among coordinators in a consortium or within a large center. My name is Michael Okazi. I'm the editor-in-chief here. I've had the pleasure to talk with several of our panelists in the past, so it's nice to talk to you again and reconnect, and looking forward to your session. What I thought I would do, since we have a big group today, is ask each one of you to introduce yourselves briefly, and then maybe talk about a big tip or idea you're hoping to share during the session, and then we'll have a little bit of a conversation about some of the issues raised and obstacles faced and ways to deal with them. So if that makes sense, why don't we start with Corinna, if that's okay, and then go down the group there.
Sure. So thank you for having us today. My name is Corinna Bowers. I'm the Senior Clinical Research Program Coordinator for multi-sites at Nationwide Children's Hospital. I'm also the Executive Director for the Pediatric Nephrology Research Consortium, and that is how this group came together. So I'm really excited to discuss in our webinar finding the connection point among the coordinators so that they can build community by identifying their shared connection points.
Excellent. Teri, you want to go? You're next in my line on my view here.
Sure. Hi, and Michael, thanks for having us today. We're really excited about this session. So I am a pediatric research nurse at Helen DeVos Children's Hospital in Grand Rapids, Michigan. I think what I'm most excited about is just how our session encourages people to reach out. Networking is so important to build that community, and I've really found my way over the last almost 20 years in research now, going to many events, so local, regional, national meetings, both in my specialty and for research, and connecting with other coordinators, and just finding what we have in common and how we've each overcome some challenges. So the networking piece of our session is really exciting.
All right, Margret, I think you're next in my queue.
Sure. To echo what Teri and Corinna have said, we are very excited to have this opportunity to speak with you today, Michael, and to present our webinar to the ACRP community. What I am very excited to share with all of the coordinators who will be listening to our webinar and what I will be presenting and speaking on is the opportunity to work with multi-generations in the workforce, in the coordinator workforce, and how to find new tools to bring different generations into the workforce, the coordinator workforce, and how to find new communication avenues and pathways to make for a more dynamic coordinator pool, to make for a more engaged workforce. We find that in working with our group, and particularly the consortium that we find that we have a lot of different generations, and it has been a very enriching experience for us, and I think that has led us to have a lot of different conversations and bright ideas that we were excited about sharing with the ACRP community.
Fantastic. Theresa.
Nice to meet you. Looking forward to our session, and again, thank you for having us. I am the Division Administrator and the Clinical Research Manager for the Division of Pediatric Pulmonary and Sleep Medicine at the Medical College of Wisconsin Children's in Milwaukee, Wisconsin. So I'm excited to be here. And my part of the talk I'm excited to share is kind of about networking on a local level within either an academic center, primarily how to take advantage of some opportunities that would be made available to coordinators, and to do this in a way that you're kind of taking friends with you, bringing friends, making friends, sharing that with that, and using those opportunities to network, as well as if you're a new coordinator, finding a way to find a mentor within your research community at your center, and then also if you're a more experienced coordinator, to be a mentor to other coordinators and help them find their way in the field. I think that an important thing I want to stress is that even when you're new or experienced, the value that coordinators bring to those sessions is as important as what we're getting from it. Having research kind of represented in those maybe more clinical or scholarly sessions is also of value to them to have us at the table. So I kind of wanted to bring that home as well. So thank you.
I want to talk a little bit about, I wrote a blog recently talking to an executive coach and someone in the clinical trial field, and both of these people were women, and they were saying that they feel, I'm speaking very generally, but that women have different challenges when it comes to networking and communicating, and that often women tend to focus more on their own departments, whereas men are, I don't know, trained as kids or something, or a little more aggressive, or reach out to other departments a little bit more sometimes. And then there's also, you know, the traditional golfing outings and guys having cigars after work or anything, or things like that. But for women, and that's a large percentage of the clinical trial workforce, can you talk about some of the unique challenges that women face in networking and communication?
I'll jump in here. I'd like to hope that most of those sort of more, you know, historical perceptions or things like that are changing. You know, as you know, we have a group of professional people here. We are also women, leaders in our community, leaders in our programs. So I think as there are more women leaders, hopefully there will be less of a, you know, sort of difference in the way that they do that. I think research can have a unique perspective too, because sometimes you may be the only research person in your section, and so it's, you are networking. We think of it sort of like a small house and a big house, and you're going to be networking and doing that thing, and you work collaboratively with all the other sessions and departments in your department or even in your institution, sometimes out of necessity because there isn't someone in your group to work with, and we have little touch points. Maybe you're all, you know, kidney research, but maybe you're all pediatrics, or, you know, you find the things, and that's kind of like a lot what Corinna's going to talk about is what do you have in common, and then kind of foster that. So, you know, I think that's my 2 cents.
So it's less about being a man or a woman, maybe more about your role in the organization.
I think so. I hope so.
Encouraging us a little more modern, because again, this was something I was writing and talking about fairly recently, and these were the views I was getting from few people. So I'd be curious to see what the rest of you think, but it's kind of encouraging to think maybe that's a little more of a relic of the past and maybe not quite so much the case these days.
I think actually that's something I would love to speak about, and I'm going to pause and say, I believe I didn't actually give you my affiliation when I introduced myself, and you can edit that part in. I'm with Emory University, so I've been the Associate Director of Research Projects for Emory University for a number of years. Speaking to what you mentioned with the difference between men and women in their leadership skill or leadership style, I think you would find in the arena of clinical research in particular that it is dominated by women, and you will find that building networking and building career development options and opportunities are handled differently. I think it is a central hallmark of what our consortium in particular wants to focus on, because it's something that the 4 of us found very little support as we were building our own careers, that there wasn't outside support for us. So we did build it on our own. So I think for us, as we open doors for the next generation, whether it is men or women, we make it an essential part of what we are teaching. And networking, you will find, is part of everything that we teach and make available for the next generation of coordinators. I wouldn't say that it is because we're women. I think it is because our generation of coordinators didn't find an established resource to tap into and a clear pathway forward for growth. It could be because the career itself is fairly new, or it could be because of the, as you say, the old school way of doing things. Regardless of why things are the way they are, at least within this group, we are working very hard to create a new pathway forward that embraces opportunities. And the opportunities are based on the passion of each individual who wants to know and do more. I think the career of clinical research is so wonderful and amazing in that it is flexible and malleable for anyone who wants to grow within it. It gives a multitude of opportunities for anyone who wants to grow with it in different directions, whether it's local site coordinators, monitoring, finance. There's a number of ways you can grow with your career in clinical research, which is very exciting. And I think sometimes it's about having conversations and having opportunities to know that there are options to grow within the career rather than exiting it due to frustration of not being able to network. And ACRP is a great place to do something like that.
We're trying, yeah. Good
So
point.
I would like to just tag on to what Margot said. I think one of the other things that we have found as we have surveyed our coordinators is that a lot of institutions don't have the budget for their coordinators to enable their coordinators to attend conferences such as ACRP. National conferences is not in the budget for a coordinator. And so, you know, we have worked really hard within our consortium to let them come to the meetings pretty much for just their airfare of getting there. Sometimes we've been able to help cover some of those costs. We cover their hotel room, we cover their food. And so we're working hard to try to bring them together. And then once we get them together, we're working hard to try to show them how they connect to other people in the consortium, either by the same projects they are working on. So our consortium is all in one therapeutic area. And so a lot of times there's maybe 10 people at that meeting who are all coordinating one particular project at various sites around the US. And so we hope to connect them so that if they need a little extra support beyond the project manager for that particular project, they can get it one to another. And then we are also, and especially like with the webinar that we're going to be doing in October, bringing to the forefront of their mind the various opportunities that they would have to advance their career, to get certified if they're not certified, to get additional education, and show them all of the various resources that are available to them to both network and to continue their growth ladder with regards to education and experience.
Fantastic. All right, Teri, you're going to be the anchor person here. The final summary, no pressure.
No, that's okay. I guess as a very young and new coordinator, I had the opportunity to work really closely with not only a physician, but a mentor. And a very pivotal point was attending a national meeting with him. We were at a study meeting, so he was my PI. And I felt really pushed to say something in this meeting, but I was the only research coordinator in the room. So as you can imagine, like 99% of the room was male physicians. And so I kind of, whispered quietly, here's my idea, here's what I think we should do. And he really took that opportunity and said, say it. I support you in this opportunity and letting other people see what you have to contribute. And that moment changed my career. I really felt not only supported, but I felt like I had a voice and that I had something to contribute in these meetings. And it really set me on a pathway of meeting other physicians, asking great questions, reaching out to other coordinators. And that's the sense how the four of us started connecting. As you could tell by our introductions, we're in 4 different states. We're separated by 12 hours of travel time, and yet we continue to network as the 4 of us and then bring our passion out to other coordinators. So this is really what our session is about, is how we came together and how we're bringing a community of coordinators together and how it's very doable, even in light of budget cuts and pandemics, to reach out and and find that support amongst other people in your profession. And you can really, as Theresa already mentioned, mentor other people and bring them into this fold as well. So.
Absolutely. Mentoring is so important. And you make a good point, because as budget gets cut back, but we have a pandemic, I mean, I overuse it myself. I get a little tired of the now more than ever expression, but now more than ever, we really need this kind of interaction and connection and support. So it's really amazing you guys have come together to do this, and we're really looking forward to your session. I don't want to give too much more away because I want people to attend this session on October 15th at 12:15. The session is called Feeling All Alone, Building Community Among Coordinators in a Consortium or Within a Large Center. And we've got Teri, Corinna, Margret, and Theresa with us today. I want to thank you guys so much for giving us your time on this preview, and we're really looking forward to your actual session on October 15th. Thanks so much.
Thank you.
Thank
Thank
you.
you.